Tuberculin skin test, also called as Mondex test or Purified protein derivative test. Since this test is used for detecting tuberculosis infection or the immunity against the tuberculosis, so this test is called tuberculin skin test. So Mondex is a scientist name, as we are injecting the purified form of Mycobacterium tuberculosis protein as antigen. So that's why we are calling as a PPD test or purified protein derivative test. So this tuberculin test or Mondex test is used to detect Mycobacterium tuberculosis infection and or the immune status against TB infection. So this is the standard method for determining whether a person is infected with Mycobacterium tuberculosis or have an exposure to tuberculosis bacilli. So this is the test, one of the standard method for detecting the person is infected with TB or not. The old tuberculin test was developed by Dr. Robert Koch in 1890, but the intradermal technique currently in use was described in 1912 by French physician Charles Mondex. So this test, Mondex test, is given to children aged from 3 months to 6 years, living at high TB risk environment and or a history of stay in a country of high endemic and or who have had a close contact with a person with known TB. So the administration of PPD injection is just a single dose of 0.1 ml, contains 0.4 micrograms of tuberculin protein purified derivative. So this injection should be stored at 2 to 8 degrees Celsius, protected from light, and this should be taken in 1 ml graduated syringe fitted with short bevel 26G needle. So this test should be given intradermally on the middle third of the flexor surface of the well cleaned left forearm. So during the injection, so the syringe should be positioned at 10 to 15 degree and insert just below the epidermis, about 2 millimeter. Immediately after injection, remove the needle quickly and do not massage. After injection, a well-defined bulb of 6 to 10 millimeter in diameter should be formed if the injection is injected properly or correctly. If the bulb is less than 6 millimeter, then you need to repeat the process. So after the injection is over, mark down the site, date and time of the injection. After 48 to 72 hours, read the induration, not the arrhythmia, and note down in millimeter. So induration means the swelling after 48 to 72 hours is caused by reactions, sensitivity reactions. So the principle of tuberculin skin test based on the delayed hypersensitivity reactions. It's totally based on the delayed type hypersensitivity reactions. You know the all type 1, type 2, type 3 hypersensitivity reactions are related with the antibody mediator. But this type 4 or delayed type hypersensitivity reactions is cell mediated immune response. So in this case, when we inject the antigen of purified protein derivative into the individual, after injection, the immunological response will got stimulated and the T lymphocyte cell got sensitized. So after sensitization of the T lymphocytes or T cell or helper T cell, whatever the name, helper T cell or T lymphocyte. So after sensitization, it will release, it will promote the release of cytokines and chemokines. So cytokines and chemokines that include all serotonins, histamines, interleukins, interferons, etc. So with the release of cytokines, the cytokines will activate the macrophages. So once the macrophages got activated, the lymphocytes and monocytes got attracted to the site of injection. So at the site of injection, when these lymphocytes, monocytes and macrophages are getting accumulated, there will be an increased local blood capillary permeability. So there will be a chance of increased blood capillaries permeability that causes induration at the site of injection or swelling at the site of injection. So this is the principle involved in the Mondex test. So it's totally based on the type 4 or delayed hypersensitivity reactions. So the interpretation of the Mondex test is very important. Still there are some confusion. I would like to explain very clearly, right? So this case, the size of the induration or swelling 15 millimeter and above. 15 millimeter and above means that states that reaction with tuberculosis bacilli, that is irrespective of the BCC vaccine status. So in this case, there is no risk of TB infection, no risk of Mycobacterium tuberculosis for the individual. This is just an immunological response or hypersensitivity response due to the tuberculosis bacilli injection, tuberculosis bacilli protein derivative. So due to the immunological response, hypersensitivity response, delayed response, there will be an induration more than 15 millimeter. If the millimeter of the diameter in duration is more than 15, there is no risk of TB since it's just a immunological hypersensitivity response, delayed hypersensitivity response. If the size of induration 10 to 14 millimeter, less than 15, that means 10 to 14 millimeter, that shows a cross sensitivity induced by environmental Mycobacterium tuberculosis and or BCC vaccine induced sensitivity, and it's confirmed the TB infection, confirmed the tuberculosis infection. If the size of induration between 10 to 14 millimeter, if the induration is around 5 to 9 millimeter, that shows a cross reactivity induced by the environmental tuberculosis and or BCC vaccination and the TB infection with immunosuppressive conditions. So this person having the TB and there will be a situation like immunosuppressive situation. The same situation arises with the HIV. Same situation arises with the HIV. So the size of induration between 5 to 9, that indicates that TB infection. Then the final one, size of induration is less than 5 millimeter, means absence of any risk of TB infections. So there is no risk of TB if the induration is less than 5.